Hey everyone, it's Dr. Lisa L. Campbell. I hope you all are having a wonderful weekend. So, as I mentioned previously, am out of town for the holiday. And so I peeked into the course just to look at quizzes and really look for trends in what I am seeing from an error perspective. And one of the things that I think is very important is that when possible, I try to what they call course correct what you all are doing with your assignments. So in this video, I want to offer some tips that will prove to be very helpful as you continue this introduction to ICD-10 CM journey. So number one, my first point, when you are looking at a multiple choice scenario, the first thing you want to do is review each code and its description. And I'm using this particular question as an example because the codes and their descriptions are there. In our class, when you take a quiz, only the codes are there, so you'll have to use the electronic manual to locate the codes. So why do I want you to review each code and code description? Because you need to understand and identify what are the differences in the code. So that's first up. So in this particular scenario, you got C3402, you got G893, you got C7951. And this week we're looking at neoplasms, and so you should know by now, it's the end of week 1 or week 2, you should know by now that we have malignant neoplasm primary, we have malignant neoplasm secondary. So as I look at the choices, first thing that pops into my mind is my patient's cancer primary? Do they have more than one cancer? Like, what's the deal, right? So when you're reading the question and you're paying attention to the little details, this will be beneficial, right? So this patient has chronic neoplasm related pain that was known to be caused by metastatic, it means it spread, bone cancer of the vertebra that spread from the left main bronchus. So what's important here, I think, to call out is that the bone of the vertebra is secondary and the bronchus is primary. In your textbook reading for this week, they actually talked about the concept of primary versus secondary. So that's one thing I want to point out. The other thing that, and I only looked at 2 submissions, I think there were 3 quiz submissions thus far, and I find it odd that quizzes are submitted before homework, but I've gone over that before, so I won't talk about it again. So sequencing. If you notice in answer choice C and D, they both include G893. They both include C7951. But what is missing is C34.02, which we know that our patient does have this primary cancer of the bronchus. So when I talk about you reviewing the code, looking at the description, you're really scrutinizing the answers to eliminate what does not belong, right? So option A and B don't belong because they're missing key aspects of the scenario. So when you see that you have the same code represented in multiple answer choices, so here's my second area to talk to you about. Sequencing is important. Which code goes first? So let's see if I can find another example. Okay, here's another example. So different scenario, but I want you to notice that several of the codes are present in more than one answer choice, but they're in a different order. And so when you see that, after you eliminate the answer choices that do not belong at all, that can help you narrow down. Now, when you're seeing this sequencing, you really want to look at your scenario and ask yourself, is there a coding guideline that applies? So that's my third area. So let me just pause for a second to make sure that you got the first two areas I talked about. The first was reviewing each code and its description, looking at the scenario, seeing what does not belong. Number two was about the importance of looking at sequencing because it could be in the wrong order, which means it's wrong. And then the third is guidelines. So as I'm looking at this, okay, we got a patient who has cancer and of the breast, metastatic to the liver, brain, and intrahepatic and extrahepatic bile ducts. Okay, we know they have cancer. We know they have a primary cancer. We know they have secondary cancer. Okay, think about it from the perspective of the insurance company. We know that they have these conditions. Why are they here today? They're here for dehydration. No treatment is given for the cancer. So the very next thing that you need to look at is go to your neoplasm guidelines and see if there is a rule regarding this situation. Let's plug over to the guidelines and see. All right, so here is the table of contents for the ICD-10 CM guidelines. And I know it's just week 2, but I'm really trying to get you guys to build good habits now. And let me just tell you, I'm not saying that I'm all that in a bag of chips, right, when it comes to teaching coding, but I've been told I do very well. And many students across the country would love to have someone that's going in great detail like I do for you on a regular basis. So I just really hope that you lean into this guidance because it's going to make you a better coder. All right, so, look at the table of contents and seeing, okay, where do I go here? And if you don't know, you just go over to the guidelines, like to the actual words. So, you got a couple of options. You got sequencing, neoplasm codes, right? So let's just see if we can find something. Primary malignancy, secondary malignancy, pregnant patient, complication. When an encounter is for management of a complication associated with the neoplasm, such as dehydration, and the treatment is only for the complication is coded first, followed by the codes for the neoplasm. And then the only exception to this is anemia. Well, let's just go back over to the scenario I was looking at. Okay, so we know, just based on that guideline, that the dehydration should go first. So let me tell you what happens here in my, this is called deductive reasoning skill. Bam, you're out. You're out, right? Okay, so now that leaves me with option A and B. Well, what's the main difference between A and B? And that leads me to point number 4 for this video. I talked about you guys reviewing each code. Guys, when the code is 1 digit off, look at the differences. Look at your scenario to get your final answer choice. All right, so I'm not going to even get into that, but you should see. And so I have one last thing to cover today, is about combination codes. And remember, combination codes are where you can have multiple conditions in one code. And one of the things that I have found is that oftentimes when people have the wrong code, like maybe it should have been 1 code, but they got 5 codes, something like that, you either didn't read the guidelines, or in our case, in the textbook, there was a rule that was given to you that you did not apply when you took the quiz. The purpose of the quiz is to apply the concept. purpose of the homework to apply the concepts. I hope you all have a great weekend. I'll see you on Tuesday. Bye.